Imagine waking up on New Year's Day to discover that your access to affordable healthcare has vanished overnight. For nearly 34,000 legal immigrants residing in Massachusetts, this scenario is set to become a harsh reality due to recent federal policy changes. These individuals, who include low-wage workers, international students, asylum seekers, and others, are among the first groups to lose government-subsidized health insurance under legislation signed by former President Donald Trump last month. And here's where it gets even more challenging. Most of these residents live below the federal poverty line, meaning their financial stability is already precarious at best. The state of Massachusetts plans to discontinue a specific category of health insurance plans known as Type 1, which were offered through the Massachusetts Health Connector, the state-run marketplace designed to help people obtain coverage. This program was created specifically for legal immigrants whose incomes qualify them for Medicaid, but who must wait 5 years after entering the U.S. legally before they can apply for that program. Currently, Type 1 plans are funded almost entirely by the federal government, covering nearly all medical expenses with minimal copays for brand-name medications. However, starting January 1st, those subsidies will cease because of provisions included in a federal budget and reconciliation law passed along party lines in Congress. According to officials, this group, comprising some of the poorest legal residents in the country, will no longer be eligible for federal assistance under the Affordable Care Act. This development comes as part of broader cuts affecting various subsidized health insurance programs nationwide. The Massachusetts Health Connector has begun notifying affected residents about these impending changes, including those tied to other expiring federal subsidies. As a result, many individuals currently receiving aid will soon face higher premiums once the new rules take effect next year. Personalized letters explaining the loss of support are expected to reach households by October, giving recipients limited time to explore alternative options. What makes this situation particularly poignant is its timing. The elimination of subsidies coincides with the 20th anniversary of Massachusetts' groundbreaking 2006 healthcare reform law, which aimed to provide near-universal health coverage for state residents. Audrey Morse-Gastier, executive director of the Health Connector, described the moment as painful, emphasizing how much effort the state has invested over 2 decades to ensure that all lawfully present residents have access to health care. She noted that rolling back these commitments feels like undoing years of progress and betraying core principles that guided Massachusetts' pioneering work. Gastier highlighted the extensive outreach efforts undertaken by the Health Connector to assist immigrant communities, stressing that ensuring everyone stays healthy benefits both immigrants and native-born citizens alike. Data from last year shows that only 41% of legal immigrants enrolled in free coverage actually filed medical claims, a statistic that helps keep costs manageable for everyone. Yet now, she lamented, much of this hard-earned progress risks being dismantled as the federal government withdraws critical support from people who followed the rules, came to the U.S. legally, and deserve equitable access to health care just like anyone else. While some residents impacted by these initial cuts may qualify for different types of insurance, navigating these alternatives won't be straightforward. For example, international students might need to purchase private insurance independently. In other cases, changes such as increased income, shifts in immigration status, or family growth could render certain individuals eligible for other subsidized plans. Still, finding viable solutions remains uncertain for thousands. Ending subsidies for low-income legal immigrants is projected to save the federal government approximately $250 million annually in Massachusetts alone. But will state leaders step in to fill the gap? Governor Maura Healey acknowledged the severity of the issue in an emailed statement, saying, "While no state has the resources to fully offset these devastating cuts, we are exploring every possible avenue to safeguard residents' health care." Advocates for vulnerable populations warn that losing access to affordable health care will harm not only patients, but but also strain the state's healthcare system. Vicky Poulos, a senior health law attorney at the Massachusetts Law Reform Institute, painted a grim picture. Unless alternative coverage options emerge, or existing state programs expand, tens of thousands of lawfully present residents will find themselves without recourse when illness or injury strikes, forcing them to rely on overcrowded emergency rooms. This trend carries ripple effects. When uninsured individuals cannot afford care, hospitals often pass the costs on to taxpayers or raise prices, driving up overall healthcare expenses. State estimates suggest that once all healthcare-related reductions outlined in the Trump-era reconciliation bill are implemented, Massachusetts stands to lose $3.5 billion annually, impacting around 300,000 residents who could lose their health coverage. State Senator Cindy Friedman, co-chair of the Joint Committee on Healthcare Financing, echoed concerns in an email, asserting that no one should face barriers to accessing necessary healthcare. Her team is actively reviewing the implications of these specific provisions and considering potential responses in collaboration with colleagues and stakeholders. Despite repeated attempts to seek comment, Republican leaders in the Massachusetts legislature have remained silent on whether they support using state funds to cover residents losing insurance due to federal policy adjustments. Meanwhile, questions linger. Should states shoulder the burden left by federal retrenchment? How can society balance fiscal responsibility with ethical obligations to protect vulnerable populations? We'd love to hear your thoughts. Share your perspective in the comments below.